Hello everyone, hope all of you are doing great. Welcome to the chapter number 4, which is recognizing anaphylaxis. So early recognition is very critical in cases of the anaphylaxis because it often evolves within minutes and a delay in the diagnosis can cost lives. Anaphylaxis typically occurs within 5 to 30 minutes of the allergen exposure. The faster it begins, the more severe it usually is. Skin and mucosal signs. The cutaneous signs are most common and usually the first to appear. There are two types of skin reactions that could occur. There could be urticaria, which is the development of hives on the surface of the skin, or it could be angioedema, which is basically the swelling of the lips, eyelids, and tongue. If there is flushing and itching, these are visible and should always trigger this alarm bells in your mind for the development of the anaphylaxis. Respiratory symptoms. Next come the respiratory signs, which are often mistaken for the asthma or the panic attack. If there is wheezing, stridor, dyspnea, throat tightness, hoarseness, or nasal congestion, or if the patient is coughing excessively, if there is airway involvement, it signals towards the development of the severe anaphylaxis. Then comes the cardiovascular features. The cardiovascular system responds with two features. One is known as hypotension, that is reduced blood pressure in the body. And then in order to compensate for that, your heart will start beating faster, which is known as tachycardia. So the cardiovascular system is basically doing two things. One is hypotension, which is reduced blood pressure. Along with that, your heart is beating very fast, which is known as tachycardia. In addition to all of these signs, the person could also develop dizziness or even syncope. You need to remember that circulatory collapse is a hallmark of the full-blown anaphylactic shock. Then GI and neurological symptoms could also appear in a patient who might be suffering from the anaphylaxis, if other systems can also be involved. So what are the symptoms of the involvement of gastrointestinal system? It could present in the form of cramping, it could present in the form of vomiting, or it could be diarrhea. Then the neurological signs could include headache, confusion, and sense of impending doom, which is a real clinical warning. Now, how to recognize anaphylaxis early? You have to think of anaphylaxis if two or more systems of the body are getting involved, especially after the allergen exposure. The typical triad of the anaphylaxis include there are skin signs including the urticaria, angioedema, flushing and itching of the skin. There is respiratory compromise in which there is stridor, there is hoarseness of the voice, there is coughing, there is airway tightness, and then we have the circulatory systems. You never have to wait for all the systems to develop. You have to treat the anaphylaxis on the earliest. And that's it from our side. We will see you in the next chapter very, very soon. Good luck and have a nice day.